Good afternoon, everyone. You're very welcome to the 2021 AGM Annual General Meeting for Northampton General Hospital. Firstly, I'd just like to apologise for it being later in the year than normal. It's been a difficult year, and for a whole variety of reasons, we, like many other trusts, have had their AGMs rather later in the year. And that makes it sometimes quite strange to be talking about events that happened between April 2020 and April 2021, which, given the pace of things this year through COVID, has been makes it even more strange to be talking about things that long ago. First of all, I think it's probably worthwhile just saying thank you to the staff, in particular the wider group of staff. There's a great sort of sense that hospitals are clinical staff, or even doctors and nurses on occasions. And there's many tens of professions in a health service, but in a hospital, but there's also lots of other staff in lots of other roles that we could not have got through the last year of COVID without. And you'll see in the slides coming up later, there's particular reference to our volunteers and our volunteer coordinators, and there are other ones that we just need to think about. The procurement people who kept us going through PPE crises, and there are just a wide range of staff, our domestic staff who went beyond the call of duty to try and maintain the cleanliness and infection control. So I just want to talk a little, just for a moment, make people think about the wider team that we need to thank for all of this. And also perhaps just to reference the challenges ahead as we move from out of COVID with all the pressure on us. We are one of the best hospitals around for long waits. We don't have nearly as many as neighbouring hospitals, and our patients, we have continued treating them throughout the pandemic. But now we move into our elective care recovery programme, but we also move into an integrated care system with the Integrated Care Board for Northamptonshire and other health and social care colleagues. And that will be most of the focus of the work over the coming year, and you'll no doubt be hearing a lot about that going forward. Great opportunities, but also great complexity and a great requirement for patient-public involvement and our staff to think in the widest possible way. So on that basis, we just move on to the agenda. I've done my introduction, and I'm going to move hopefully seamlessly into Simon Weldon, the Group Chief Exec's annual report, and then seamlessly into the other two reports before coming back to Q&A. Before we do that, though, I just want to remind you that in the top sort of right of your screen, there's a little box marked with a question mark, which is Q&A. And we have a question and answer opportunity at the end, and the best way to do that is to type any question or comment you have in the box after clicking on that little question mark icon. It's just to the left of the video camera in most computer screens at this point. So questions in there, if you would, please. Thank you very much. Simon.
Thanks, Alan. It's good to be here and spend some time reflecting on where we've been and what lies ahead. If I could go to the next slide, please. My thanks, my chance to say thank you too, I think, first of all. Alan has thanked people for what's gone on over the past year. And I'd also like to just spend a moment thanking people who are right now keeping the hospital going. Wherever you are, wherever you're working, whether you're a volunteer on a ward or driving the hospital buggy, whether you're a surgeon operating on people, whether you're a nurse caring for people, we understand that the hospital is under huge pressure. In part, of course, that's due to COVID. And lest we forget, COVID is still very much with us. 10% of acute beds across Northamptonshire approximately are still occupied by patients with COVID. And I remind everybody here again, because it's important too, the biggest thing that anybody can do to help the NHS, whether you are a member of staff, whether you're a patient or somebody who's just in the community, is to get the vaccinations or the boosters, because they will really help make a difference to how we cope with what is going to be an undeniably tough winter. Flu vaccinations are now also readily available, and again, I would encourage people to take up their flu vaccinations as fast as possible. Even in quiet years in flu, we have more than a ward's worth of patients who come into our hospitals with just common old flu. It's a serious illness, and the biggest thing you can do to help us in the NHS is get vaccinated. And we would receive that as those who work for you in the NHS as probably the biggest thank you that you could pay us. Can I go to the next slide, please? So a little bit about us. Lots of good things happening. I'll pick on a few here. So buildings are going ahead apace. We've already opened, and we're really grateful for the Princess Royal coming to open our new paediatric emergency department. And later on, hopefully by the turn of the year, we'll be opening the new critical care unit, which will be a state-of-the-art facility, not only in Northamptonshire, but also when we look at ourselves compared to some of the other counties around us, we will be have class-leading facilities. The other point I wanted to make on this slide really was some of the hugely innovative work that our volunteers have done. COVID really did cause us all to reinvent a lot of what we were doing. And when you think about it, we had to go from a situation where a hospital was really embedded in its community, part of its community. You could come and go into a hospital as easily as you like, to a place that was extremely hard to get into for entirely understandable reasons. And the work that our volunteer video service did, connecting patients with their loved ones, helped over 3,400 people during that time that we've been through. And it was great that our volunteer coordinator, Emma, was honoured with the British Empire Medal in the Queen's Honours Awards, because it really reflects the difference, the value that volunteers can bring to the community of the hospital. Could I go to the next slide, please? Just a few things. You can read some of these things. You can see that firstly, COVID was not only unprecedented, but the response was also unprecedented. So the teams here at NGH played a key role in helping the development of the dexamethasone treatment. And that really has started to change the game in terms of how people are treated in hospital in COVID. Remember that? It feels like a long time ago now, but people in teams and clinicians in NGH were instrumental in terms of making that happen. It's fantastic when you think about the innovation that people do on a day-to-day basis. Can I go to the next slide? I've already talked a little bit about the volunteer team and the work that they did, but it's not just all of that. They've been so supportive of our staff right throughout and now beyond COVID. And the work that we're now doing is a volunteer team, not just in NGH, but across the group, to try and make ourselves one of the largest employers of volunteers in the community. Because volunteering, I started out as a volunteer, isn't only a route of service in retirement, though that's fantastic. It's also been, for many people, a route to support them throughout COVID, and perhaps now a route into new employment. Another significant achievement out during the year, and the photo that you see there is now thankfully far further developed than that, as I'm sure those of you who visited the new hospital entrance attests. But the hospital entrance that has been delivered is a really fantastic facility for staff and patients. People notice buildings. We forget that the built environment has a big impact on how staff feel and on how patients feel as they come into a hospital. And the new entrance has given a whole new level of facilities for both staff and patients. And I wanted to take a moment to congratulate the estates team, often unsung, sometimes the recipients of quite critical commentary, because inevitably with an estate as complex as Northampton, there's always a bit of it that's not working. But also the people who deliver amazing new facilities for our patients, as well as keeping the lights on. So Stuart, I know that you're here today, and I'd be really grateful if you could pass on our thanks for that collective endeavour. Remember, that happened throughout COVID as well. All of this has kept going. So well done to the estates team. Next slide, please. I've just highlighted Emma's achievement, and I should also pay tribute to Peter. Both were awarded the British Empire Medal, and I think that's a real testament to the strength and depth of our volunteer services. And remembering December, I remember being on site that day. We were one of the first 50 vaccination hubs in the country. So when the Pfizer vaccine went live, we were there vaccinating patients for the first time. Some of the first patients in the country to get vaccinated were some of our most elderly and vulnerable patients in our community. Again, a fantastic achievement for the team who got that set up in pretty much, just for those who don't realise this, we got notification and people got it going in pretty much under a week. And we were starting to deliver vaccines thereafter and have continued to do so at various times since then. Next slide, please. Critical care team. There have been many front lines in the battle against COVID, and the critical care team had a chance to share their experiences of what their front line was like. One of the things that I draw attention to that, because one of the things that I think is going to be key, not just now, I've often talked about the fact locally that there are kind of two pandemics really. There's been the pandemic when we were at full tide in terms of the illness that was in the hospital and in the community. But there's now the post-pandemic, and the post-pandemic is just as hard, arguably harder. And it was great to see that the work of the team here at NGH as health and wellbeing employer of the staff was recognised. But that last bit of that sentence, beyond, is something that we should really pay attention to. The beyond part of it is some people will live with the consequences of what they had to go through in COVID for many years. They were there for us when we needed them. It's equally as important we are now there for them when they need us. Can I go to the next slide, please? And on that note, can I say once again, thank you to everybody who is keeping the hospitals safe and going at the moment. We will continue to do our best to work, as Alan said, with our new partners in the community to make sure that we do all we can to support you. We owe you a massive debt of gratitude, and on behalf of everybody here in the board, I'd just like to say thank you. With that, I'll hand over to John to talk about the year in review from a financial perspective.
Thank you, Simon, and good afternoon, everybody. So I'm John Evans, the Group Chief Finance Officer over Northampton and Kettering General Hospitals. I'm here today to present to you our financial performance across the 2020-21 financial year and a summary of the accounts. If you could go on to the next slide, please. So Northampton General ended the last financial year with a surplus of £1.1 million. So in terms of the arrangements that were in place last financial year, they were quite strange, certainly given the first in my finance career. We had an arrangement in the first 6 months of the year as part of an emergency response to the pandemic, where we were essentially reimbursed for all reasonable costs. And in the second half of the financial year, we moved to a block funding arrangement, i.e. not being paid for the clinical activity that we delivered, as was the case pre-pandemic. And that set of funding was there to fund the cost base of running a hospital and to provide enough resource to support our NHS services. In terms of the national expectation for performance, we were expected to deliver break-even or better across the system. That's the system of Northamptonshire, and I'm pleased to say that we contributed to the delivery of that with our financial performance. Next slide, please. So we, as any other year, had a set of annual accounts to produce. I'm pleased to say that the accounts received an unqualified opinion from our external auditors, Grant Thornton. That means they presented a fair view of our performance and of our trading. There were a few items that were picked up and flagged by our auditors as areas that we would seek improvement on moving forward. One around our statement or overstatement of financial liabilities, one around the process for valuing land and buildings, and the final one around specific revaluation for parts of our site. I'd like to say that the accounts and review process was quite challenging. Nationally, this is not just for us as an organisation. Our auditors, I think, did a very good job and a very thorough and comprehensive job in a set of difficult conversations and contexts. So within that, and within a lack of kind of clarity often around how to move forward with some of these things, I think we got to a really pretty decent position. The key thing to pick up there is the unqualified audit opinion, as I've said. Could I move on to the next slide, please? So as part of our auditor's annual report, they are required to report on 3 key areas of performance and their view, which is predominantly a review of existing arrangements and then forward looking. Those cover financial sustainability, governance, and then improving economy, efficiency and effectiveness. We received a significant weakness around financial sustainability, essentially around the Trust's underlying deficit pre-pandemic and the lack of an up-to-date medium-term financial plan. I'd like to say that the situation around having an underlying deficit and a lack of forward-looking financial plan is not uncommon and is not specific to Northampton General. At the time that the reports and the audits were being carried out and the reviews were being carried out, we didn't have an organisation or nationally know the financial arrangements in the second half of the 2020-21 financial year, and we didn't and still don't have clarity on what those financial arrangements will look at moving forward a couple of years. So the challenge is reasonable and the review is fair. However, the context in which we find ourselves as a national finance team responding to the pandemic means that those things that might otherwise be in place are not there and have not been there. We've received no significant weaknesses around governance and around improving economy, efficiency and effectiveness. Next slide, please. So I thought in terms of the context of economy and effectiveness and efficiency, it will be worthwhile presenting to you some of the national benchmarking data that we have available to us as a hospital. So we provide data from a finance point of view to 2 key forums. One is as part of a national cost collection exercise, and the other one is to a system called NHS Model Hospital, which seeks to compare how we spend money and how we use our resources and kind of clinical and quality indicators with peer groups and across the country. What that data tells us for 1920, the data isn't available for 2021 for obvious reasons. It shows that Northampton General as a whole is actually a comparably lower cost provider, not to a significant degree, but certainly on that lower than average cost scale. And for context, when we look at our average cost of providing activity, a thing called weighted activity units or WOWs, in the last bullet point there, you can see that the average cost of us providing a piece of clinical activity, this is weighted for complexity and case mix, is about £100 odd lower than our peer average, and I think that really indicates the level of efficiency that the hospital is currently run with. And as I said, that plays out in our review of our external auditors around economy, effectiveness and efficiency. Next slide, please. So capital spend, there was a significant amount of investment into the estate, as Simon has alluded to some of the major programmes. Certainly compared to the level of spend that that we had incurred the previous financial year, it has tripled. You can see on screen a key number of areas in which that spend has happened: the critical care bill that we've referred to already, and paediatrics ED. There are also significant volumes of spend around emergency infrastructure for electrical and fire that helps ensure that our estate is fit for purpose and is resilient in those key areas of safety, and also spend around our COVID response, and then wider kind of buildings backlog maintenance and essential works. We continue to invest in digital, as we do at NGH and across the group, and you can also see some spend there around medical equipment as we continue to refresh and replace those levels of equipment. Next slide, please. So looking forward to this financial year, I thought it was helpful to say for context kind of where we are. So those revised financial arrangements around us receiving a block payment to run the hospital, i.e. we're given a fixed amount of money to cover the costs of running the hospital. We haven't gone back to a cost and volume type approach that was in place pre-pandemic. And that's as a reflection of the ongoing challenges that we have around response to the pandemic and moving forward. We continue to work with our system partners across Northamptonshire and across the group with Kettering General Hospital, and really the focus of delivery from a financial and operational performance point of view is very much on that system delivery, and we continue to engage with and to develop our plans for how we best use the resources across Northamptonshire with our partners. I'm going to move on now to Matt and Sharon for our quality report.
Thank you. Thanks very much. Hello everybody, Matt Metcalf, Medical Director. I wonder if we could have the next slide, please. So it will be difficult to touch on the quality of care that we've been giving at Northampton General Hospital in the year in question without thinking very heavily about COVID. And I'm going to start with something we should be rightly, truly proud of in terms of our COVID-19 vaccination. So, of course, Great Britain led the first global population mass vaccination campaign for COVID-19, and Northampton General Hospital was one of 50 hospital hubs on the very first day of that programme, mass vaccination, and we vaccinated over 100 staff that day. And to date have now delivered well over 30,000 vaccinations in the hospital site. And the following month, the vaccination centre that many people in the population, if they are watching, may have had at Moulton Park, that's also actually a part of Northampton General Hospital. We work together with lots of other partners in the county to get that up and running, but it's a part of our patch. And between the vaccination centre and the hospital hub, we've now delivered a total of well over 250,000 COVID vaccinations. That's getting on for a third of all the vaccinations given in the county. So really doing our bit to help keep people well and out of hospital. Staying on the theme of COVID a little longer. Before I move on from vaccination, I would like to just land on a couple of people who were absolutely instrumental in driving the vaccination effort forward, and Rachel Westwood, who at the time was acting chief pharmacist, and Claire Brown, our indefatigable head of occupational health, were really superb. Remote monitoring is a little later down the COVID pathway for patients who were unfortunate enough to succumb, but who happily were not ill enough to actually need in-hospital treatment, but weren't quite well enough to feel confident letting them go home without keeping an eye on them. Introduced a novel technology for remote monitoring of patients with consultant oversight and looked after by our restart nurses, making sure that we could keep at any one time approximately a ward full of patients safely at home. And given that during the second peak of COVID, when we had over 250 of our beds occupied by COVID patients, everything that we could do to safely keep people out of our hospital beds made a difference in terms of patient safety. And again, many people involved in delivering that piece of work, but the linchpin, the engine of that was Dr. Fiona McCann, the respiratory lead consultant, and we're deeply grateful to her. Next slide, please. So again, remaining on the theme of COVID, our pathology labs got lots of shiny new pieces of kit so that we could do PCR tests. Who would have thought that the general population would understand what polymerase chain reaction would mean 18 months ago, but I think we're all pretty familiar with it now. And in order that we could safely see and assess our patients in the emergency department when they turned up, and then direct them to wards that were for COVID patients or otherwise, for out of hours, we needed to be able to do PCR tests and have results available within sometimes as short as sort of 90 minutes. Otherwise, the emergency department would have been overflowing, or we'd have ended up mixing COVID and non-COVID patients and all the risk that follows with that. Our pathology labs do not have the normal levels of staff that you would need to run a 24/7 service, and it was a huge ask. And so on an individual basis, I'm going to have to give a huge shout out to Gus Lusak, our imminently retiring head of pathology services. He has done us and our patients proud. And also a massive thank you to colleagues at the University of Northampton who came and participated in that on-call rota in a spirit of true collaboration to make it possible, keep patients and colleagues safe. So staying with that academic theme, but stepping away from COVID for just a moment, we haven't completely neglected everything else. And one of the things that the Northampton General Hospital has done in partnership with Universities of Leicester and Northampton, and indeed our friends in Kettering General Hospital, we've developed an academic strategy in the reporting year to put us on a path towards becoming university teaching hospitals within 2 years. And that strategy was adopted by our Public Trust Board in January. And just to take a moment to dwell on why that is a good thing for our patients and a good thing for our colleagues. For patients, being able to have access to cutting edge treatments and studies is in itself a desirable outcome, and it is really well documented and a matter of record that hospitals that do lots of research also have better outcomes, including lower mortality. And from a staff perspective, a broader opportunity to teach or train, to innovate or engage in clinical research, to have a broader portfolio of work. It makes it a more attractive place to come and work and a more attractive place to stay. And again, on the spirit of recognising that there are many people who contributed to that, but the individual who I'd like to just shout out for is Kay Faulkner, our Associate Director of Research, Innovation and Education. Next slide, please. And whilst we were developing the strategy for the future, we didn't neglect the very real needs for research in the here and now, and particularly, Simon's already alluded to it, but the COVID was an unknown disease pretty much at the start of the reporting year, and getting to grips with it and working out what effective treatments looked like, including dexamethasone and now many others, involved engaging wholeheartedly in research. We had an absolute record number of research activity for Northampton General Hospital through the year, and indeed for the size of the hospital, punched well above our weight, and we're consistently in the top 10 hospitals contributing to urgent public health studies that helped us learn about and fight this dreadful disease. And my thanks in particular for driving all of that goes to Michelle Spinks in our research team. Thank you very much. I'll hand over to Sharon.
Thank you. Good afternoon, everyone. Could I have the next slide, please, Kieran? My name's Sharon Oak. I'm the Director of Nursing, Midwifery, Patient Services here at the Trust. And I've just got a few slides that I'd like to share with you, really giving you some concepts and assurances around how we're able to deliver high quality care to our patients. And I want to first start off by saying a huge thank you and tribute to all of our staff, but over the course of the last year, particularly our nursing and midwifery staff, we've put a huge amount of effort into recruiting staff and retaining the excellent staff that we have in the organisation. And it was an absolute pleasure that when we got to the end of March this year, our vacancy rate for registered nurses and midwives was sitting at less than 1%. And that's a phenomenal achievement for us to make across the organisation, because not only are we keeping the nurses and midwives that we have in the organisation, we've also been actively recruiting healthcare assistants, and we've been recruiting internationally educated nurses from predominantly Philippines and India, and they've been really welcomed into our organisation and have quickly become part of it. Next slide, please, Kieran. We've also been looking very much at our patient experience, because as colleagues have already said, it has been a really difficult year for all of us. So we've kept very much on board with making sure that we ask our patients what they think of the service that we've had. We've used the friends and family test, and it's been really good to see that over the course of the year, as difficult as it's been, we've maintained our friends and family percentage satisfaction rates above 90%, and we've been absolutely consistent in achieving that. We've also been looking very much at how we can keep in contact with our loved ones and carers. And if we can go on to the next slide, please. I'd just like to really say a huge thank you, as colleagues have already mentioned, to our volunteer service. When we were in the pandemic, we had no visiting in within the organisation unless it was for particular circumstances. But it was our volunteers that came in every day and delivered the letters to loved ones, as you can see in the picture here. But also they ran a virtual visiting service, being based on the wards, using technology to connect our patients with their families via technology. They also had pick-up points at the main entrances where family members could drop off provisions for their loved ones, and they were then taken to the ward areas by our volunteers. So our volunteers have played a huge contribution to keeping our patient satisfaction levels as high as they have been. But we've also been taking learning out of what our patients have been telling us as well. And through the friends and family test, they told us that actually we could be giving them a bit more information around medication when in hospital and when being discharged. So we've done a focused piece of work over the course of the last few months that have really enabled us to address that area of weakness and see an improvement, and that's been noted, and we continue to monitor that. Next slide, please. Another group of people I'd like to say a huge thank you to is our complaints and PALS staff under the leadership of Lisa Cooper. They've done a phenomenal job over the course of the year, not only having to manage the complaints and concerns that have come into the organisation, but they've staffed a relative helpline 7 days a week to make sure that any visitors or any family members that wanted to know what was happening, etc., came through to the helpline and were given the support that they need. An absolutely incredible job that they did, whilst also maintaining the response rate to complaints that are made within the organisation. And you can see there, 99% of responses were provided within agreed timescales. So a huge well done, Lisa and team. Next slide, please. Clearly, we've been talking about COVID, and that's been a huge factor that's influenced the activity that we've undertaken. So 2,584 patients with COVID were treated within NGH over the course of the year. And you can see quite clearly from the slide how that's peaked in January, peaked in March, and the challenge that's faced us. We've done lots of things in the organisation to help keep our patients safe. We've zoned the hospital, we've put doors on bays, we've made sure that our staff are trained in the correct use of PPE, mask fitting, etc. And the IPC team and Basil Awalti, our microbiologist, has been absolutely phenomenal as well in making sure that the team's out, visible and keeping our patients safe. So a huge thank you to them. And they continue to do the work as we continue on the journey of the pandemic. My last slide, please, Kieran, is recognition. And it's been really important over the course of the last year that we recognise the hard work and effort that our staff have been making. And here's just some examples, and I could have put many more slides together that really just demonstrates how we are recognising and thanking our staff. We've given out over 600 Terrific Tuesday mugs presented to staff. Any member of staff can nominate a colleague to receive a mug, and they get the message within their mug that tells why they've been nominated for that award. We continue to use the Daisy Award, which is an International Nursing Midwifery Award for staff that really do go above and beyond. We've presented Cavell Star Awards, which are individual awards made to individuals, also for people that go the extra mile. We also last year were nominated for 2 awards at the Royal College of Midwifery, or Midwives, for exceptional service and care during pandemic and race matters. And whilst this report goes to the end of March, I am absolutely delighted to share with you that last week, actually those awards were made, an absolute pride and privilege that we were successful in winning both of those awards that we were nominated for. So huge congratulations to Team Maternity. And so on that note, thank you, I'll stop.
Thank you very much, everybody. Can I just remind you about the question and answer facility, because I don't see any questions. Can I just ask you, Sharon, to give people time to ask a question, can I just ask you, Sharon or Matt, to bring us up to date on how many COVID patients we have in the hospital this week or even today, and how important it is for people to behave in the knowledge that we still have a pandemic on our hands.
Thank you, Alan. We have got 56 patients currently in the hospital with COVID infection, quite a few of those needing significant ventilatory support for their lungs. And unfortunately, and as your question implies, many of those have not been vaccinated for whatever reason. So coming back to Simon's point at the beginning of this session, the single thing that people can do to help themselves and to help us is to get the jab if they haven't.
And the other thing that's really important is that when in hospital, we're still maintaining the good infection control principles that have existed all the way through. So coming into hospital, we're still expecting individuals and visitors, members of staff, we're still wearing masks, we're still socially distancing, and we're still gelling our hands. And we're going to maintain that just to make sure that we maintain safety for not only ourselves, but our patients.
Okay, thank you for that. Does anybody else on the call have any questions they want to do verbally? Because I have no questions in the Q&A. No? No? None at all. Okay, Stuart, would you like to just take a minute and bring us up to date on where we are with the new intensive care unit and when we might expect it to open?
Yeah, thanks, Alan. So it's been a really challenging project because I'm sure lots of people have heard how difficult it is to get materials in the current climate. That said, we have a programme that will deliver a building that we can start getting our staff into set up in December into January, with the hope of seeing our first patients in January/February. Again, a challenging programme, but we were good in getting ahead of ourselves and pre-ordering a lot of the materials. So we are on track to see our first patients in there January/February.
Okay, thank you very much. As I say, I still don't have any questions, so I'm going to give it another few seconds really, and then close the meeting as the end of the AGM for 2020-2021. Okay, thank you very much, everybody. I think the presentations were very succinct. It's always difficult to do it in a virtual sense. Thank you very much for your attendance and all those people who came in the other way and were here to listen but not participate. So thank you very much for that, and Thank you for attending our AGM. Goodbye.